Good morning, everyone. Thanks for joining our session. Today, we'll talk about the DOT return to duty process. We'll talk a little bit about the clearinghouse, as well as our partnership with CMCA and how it benefits you. My name is Julia Reismandel. I am the lead account development manager here with ASAP. I have been with ASAP for 10 years now, and I work with clients, both regulated and non-regulated, to help support drug-free workplace policies, as well as DOT SAP services. My contact information is included, as well as our account management email address. Please don't hesitate to reach out if you have any questions or needs, or assistance with making a referral to get an employee or a candidate through the process. So for today's agenda, we're going to cover a little bit about ASAP and our history. We'll talk about the FMCSA Clearinghouse, what it is, what an employer's responsibilities entail in the clearinghouse. We'll talk about the Clearinghouse 2 ruling that came into effect in November of 2024, who is authorized to act as a user in the clearinghouse. We'll touch on some recent data and statistics from the FMCSA Clearinghouse, what to expect for a DOT SAP case in the clearinghouse, the return to duty process. We'll touch on some workforce health statistics, and then we'll talk about our partnership with CMCA to help support you all with return to duty and SAP needs. So a little bit about American Substance Abuse Professionals. ASAP is a partner with CMCA to provide drug-free workplace substance abuse services and DOT compliance services to help employers reduce workers' compensation claims, improve workplace safety, maintain federal compliance, minimize healthcare costs, increase employee retention, as well as enhance employee morale and maximize profits. ASAP is a recognized industry leader since 1997. ASAP services continue to evolve to promote public safety, business productivity, and individual well-being while maintaining the quality and integrity our clients deserve. ASAP does provide a full menu of substance abuse risk management services that are available to all clients, both DOT SAP and non-DOT SUD evaluations, comprehensive case management throughout the process, aftercare compliance monitoring, as well as policy development. If you are needing assistance with either developing or updating your DOT or non-DOT company policy, please reach out to ASAP and we're happy to assist with ensuring your policy is up to date, as well as meeting regulatory and state requirements. So what is the FMCSA Clearinghouse and what does it mean for you? The FMCSA Clearinghouse was officially launched January 6, 2020. It is a secure online database which shows real-time information to employers and other authorized users about drug and alcohol program violations for commercial driver's license holder and commercial learner's permit holders. The purpose of the clearinghouse is to improve safety on the nation's roadways, as well as give employers information needed to make informed decisions about drivers and safety-sensitive positions. So who is required to register in the clearinghouse? All CDL and CLP drivers who operate a commercial motor vehicle on public roads, as well as their employers. This includes, but is not limited to, interstate and intrastate motor carriers, including passenger carriers, school bus drivers, construction equipment operators, limousine drivers, municipal vehicle drivers, and federal and other organizations that employ drivers subject to FMCSA drug and alcohol testing regulations. So CDL holders and mechanics who operate or repair a commercial motor vehicle that's 26,001 pounds or greater, or operates a vehicle that carries 16 passengers or more, including the driver, or someone who is required to display a DOT play card in the transportation of hazardous material. So authorized users, as I mentioned, do include CDL and CLP drivers. Employers, this does include motor carriers and other employers or of drivers operating commercial motor vehicles that require a commercial driver's license or commercial learner's permit. Consortia / third-party administrators, so CTPAs, are required to register. Medical review officers or MROs, substance abuse professionals, SAPs, as well as enforcement personnel. ASAP does act as a service agent in the regulations and does not have access into the clearinghouse. All of our SAPs who take on a DOT FMCSA case have registered in the clearinghouse and understand their roles and responsibilities of entering the initial SAP assessment date in the clearinghouse, as well as the final SAP assessment date in the clearinghouse. When a driver contacts ASAP and enrolls in the process with us, we will ask them if they have registered in the clearinghouse and confirm that they can view their violation. These pieces are essential to ensure that they can invite their SAP on record in the clearinghouse so that the SAP can enter the initial and final assessment date in the clearinghouse. So what's your responsibility as an employer? Your company US DOT number will be used to verify the information is up to date. You can verify employee information, designate your consortium / third-party administrator to act as an assistant and enter information on your behalf. So if CMCA is your CTPA, ensure that they are linked to your account in the clearinghouse and that they understand their responsibilities. As CMCA will not accept a clearinghouse designation without understood roles and responsibilities, please do reach out to the customer support team if you need assistance with services. So any owner operator as well is required to register in the clearinghouse. An employer's responsibility, if they have a drug and alcohol violation that is not a positive drug test or a refusal deemed by the MRO, the employer does need to report those violations. So this is going to include alcohol test results with a concentration of 0.04 or greater, refusals to take a drug or alcohol test, as well as an actual knowledge rule violation. So if your driver is cited with a DUI or DWI while operating their commercial motor vehicle, that is considered to be an actual knowledge rule violation. The MRO does not know about that violation, so you as the employer would be responsible for entering that. In addition, the employer also needs to conduct queries for new hires as well as annual queries. We'll talk a little bit more about queries. So what is a query? The purpose of the query is to allow an employer to see detailed information about any drug and alcohol program violation in a driver's clearinghouse record. An employer must obtain the driver's electronic consent in the clearinghouse prior to the release of the detailed information with the full query. Queries may be performed by you or by your CTPA. Ensure CMCA is listed as your CTPA on the clearinghouse if they are performing this function on your behalf. This is not to be confused with your random drug screening program, which is testing for substances in the driver system currently. Clearinghouse queries are checking for past violations reported to the clearinghouse for your employee or prospective employee. So let's talk a little bit more about the Clearinghouse 2 ruling that came into effect in November. So as of November 18th, 2024, the Clearinghouse 2 ruling came into effect. The Clearinghouse 2 ruling is downgrading essentially any driver that has an outstanding violation. So state driver's license agencies must remove the commercial driving privileges from the driver's license of an individual that has an outstanding drug and alcohol violation that has not completed a return to duty test. So if they are in the prohibited status in the clearinghouse, it will result in losing or being denied a CDL or CLP. Each state is operating differently with the time frame that someone will lose their CDL or CLP. So you do need to check with your local state driving agencies regarding the time frame involved. So here are some statistics that show September 1st, 2024, a snapshot of drivers that have one violation, drivers that are in prohibited status, the amount of drivers that have not started a return to duty process. So again, this process is to reinstate their CDL or CLP. They have to go through a DOT return to duty SAT process. and complete their return to duty test. When the return to duty test is reported to the clearinghouse by the employer or by their CTPA, the state will automatically be notified that the driver is no longer in prohibited status on the clearinghouse. The state will then be able to reinstate the CDL or CLP. As I mentioned on the last slide, the process within the state to reinstate the CDL and CLP permissions will vary by state. Drivers will be provided the specific details from their state to resolve when they receive notification of the downgrade from the state. Again, the path to reinstating your CDL and CLP always begins with the DOT return to duty process with a DOT qualified SAP, which we're going to cover in the next portion of our presentation. So what is the return to duty process? Who can act as a DOT qualified SAP? A substance abuse professional must have the qualifying prerequisite professional credentials identified in the federal regulations, such as licensed social worker or certified employee assistance professional, just to name a couple. The SAP must possess specific knowledge as well as a history in the treatment and diagnosis of substance abuse issues. A SAP must receive specific training on the DOT drug and alcohol testing rules specified in 49 CFR Part 40, as well as achieve a passing score on an examination about the regulations. There are also continuing education requirements, or CEUs, which are 12 CEUs for every 3 years. ASAP does have the ability to provide SAP services in all U.S. states and territories. To be permitted to act as the SAP in the DOT drug and alcohol testing program, you must meet those qualifying credentials. As I mentioned before, any DOT SAP that's taking on an FMCSA case must be registered in the clearinghouse and must also understand their roles and responsibilities for entering the initial and final assessment date in the clearinghouse. So with the return to duty process, when is it required? Any DOT substance use violation with existing employees or prospective employees. So positive tests, refusals to test, whether that be on a drug or alcohol test, or any actual knowledge rule violation. Actual knowledge, as I mentioned, is specific to FMCSA drivers. So if someone does receive a DUI or a DWI in their commercial motor vehicle, or they have an admission to using while operating a commercial motor vehicle, etc. Additionally, if a company does not have a self-referral or self-admission policy or language included in their policy, if someone does come forward seeking assistance, per the regulations, if there is no verbiage in the policy, that does also constitute as an actual knowledge rule violation and must be entered into the clearinghouse by the employer. So when a SAP referral source is provided, the SAP's license, training, and CEU status must be vetted to ensure that they remain current and have no violations and meet DOT requirements at the time the referral is made to the SAP. I'm sure you all can imagine that that's not an easy or quick task to accomplish, which is where our partnership with you all comes into play. So as your partner, we do assume the responsibility of providing that list of SAPs per 40.287. So we ensure that the SAPs are up to date and qualified at the time that they're coming through the program with ASAP. The first step as an employer or a prospective employer is removing that person from safety sensitive duty. Second step is as an employer or prospective employer, you must provide to each employee, including any applicant, a list of SAPs. What this means is typically 2 SAPs, their names, addresses, and telephone numbers. You cannot charge the employee for the list of SAPs, and this can be done through a CTPA or service agent like ASAP. We'll discuss this in a little bit more detail later, but CMCA does have you all covered with this requirement with your partnership with ASAP. So when someone goes through the return to duty process, what are those steps? The first step is that the employee or the candidate does have an initial evaluation with the substance abuse professional. The initial evaluation is typically about an hour to an hour and a half long. It is a full clinical evaluation that results in a level of care recommendation. Level of care recommendations do range in terms of what they look like. They can be meetings or education. It can be some counseling sessions. It can be a combination of treatments. So the SAP will outline the level of care recommendations as well as provide referral sources to the employee or candidate to complete that level of care. The SAP can also not be the treatment provider. Once the employee or candidate completes the recommendation, they are seen by the same SAP for a follow-up evaluation. That follow-up evaluation determines their eligibility for return to duty testing at a current or future employer's discretion. They are also required to do follow-up testing as well as potentially aftercare if the SAP feels aftercare is clinically appropriate. Follow-up testing and return to duty testing are always done under direct observation. Follow-up testing, again, is determined by the SAP. The minimum is 6 tests in year 1 following return to duty. The follow-up testing can be unlimited for up to 5 years. So, what to expect for a return to duty SAP case. Once the driver has requested the SAP and the SAP is accepted in the clearinghouse, the SAP has the responsibility of reporting the initial assessment date and the final assessment date into the clearinghouse. Both must be reported into the clearinghouse by the close of the next business day following the determination. So the initial assessment date and the final assessment date go into the clearinghouse so that if you are bringing someone back to work, once you get that green light that they can return to safety sensitive duty following a negative return to duty test, you all as the employer would enter that return to duty test as well as the completion of the follow-up program. We do also provide this to CMCA upon request if they are managing the follow-up testing for your employees. So the return to duty test is the responsibility of the current or prospective employer. A return to duty test cannot be completed until the employee is back to work. A return to duty test can supersede a pre-employment test. It does need to be done as direct observation and marked as return to duty on the chain of custody. And then that return to duty test, once that's entered into the clearinghouse, the employee can be returned back to safety sensitive duty. Follow-up testing is for a period of 1 to 5 years per the recommendations by the SAP. Follow-up testing is also done under direct observation. The SAP will specify if the tests are for drugs only, for alcohol only, or for both drugs and alcohol. It is the employer's responsibility to ensure that follow-up testing is completed. ASAP will provide a copy of their final report with follow-up testing recommendations to CMCA upon a client's request. CMCA can assist with the return to duty test and the follow-up testing to ensure compliance. The DER will also receive a copy of the initial and final SAP report from the SAP directly. ASAP cannot provide those as a service agent. So again, with the follow-up testing, the follow-up testing is done under direct observation. The employee is also going to go back into your random drug testing program. So if the employee gets pulled for a random, that's just part of your random process. That's not done under direct observation. Any follow-up test will be done under direct observation. So let's talk a little bit about workforce health statistics outside of DOT and some options for employees that are not covered under the regulations. An estimated 46 million Americans ages 18 or older experienced a substance use disorder in 2022. Nearly 2/3 of those people, which calculates to be about 30.1 million, were employed. So a large amount of the employees in our workforce have substance abuse issues. 1 of every 22 deaths in the US among persons ages 15 to 74 was attributable to unintentional overdose involving opioids in 2021. Workforce deaths due to unintentional overdose from non-medical use of drugs increased by almost 500% from 2012 to 2020. The National Council on Alcoholism and Drug Dependence estimates that substance use disorders cost employers $81 billion annually through lost productivity and absenteeism, turnover and recruitment costs, workplace accidents, healthcare expenses, and disability and workers' compensation. So the majority of Americans with substance use disorders are employed predominantly full-time. Substance use disorders in the workforce is costly to employers, as I mentioned, resulting in absenteeism, lost productivity, increased healthcare costs, elevated liability exposure. Workers with substance use disorders take nearly 50% more days of unscheduled leave than other workers and have an average annual turnover rate of 44% higher than that for the workforce as a whole. By contrast, workers who are in recovery from substance use disorders average nearly 10% fewer days of unscheduled leave per year than other workers. And the turnover rate for employees in recovery is 12% lower than the overall average. Turnover is extremely costly. Recruiting and training a replacement worker costs approximately 21% of the employee's annual salary and benefits. So what can you do as an employer to minimize these costs and to ensure that your workers are safe while they're operating? Review your workplace stance when you have a drug or alcohol violation. If there's an opportunity to shift our thinking on ways to assist our employees to enter and stay in recovery, encourage employees to come forward when they need assistance. Update your policy to allow for workplace support recovery programs. Consider your state requirements, especially related to THC and follow-up testing. Oftentimes, the DOT mirrored process for managing these situations is the gold standard, but it may conflict with some local or state laws. Offer education to your employees to identify signs and symptoms of potential impairment to encourage workplace safety for all. Studies do show that employees who are offered a second chance have less lost time from work and change employers less frequently. You also have the cost savings of recruiting and training with less turnover. So let's touch on our partnership with CMCA a bit further. We'll cover the materials and what they mean and when you use them. So many of us have had little exposure to the DOT return to duty process or violations if you haven't had one come up very often. When it happens, oftentimes we see employers panic about what to do and how to handle the situation. As your service agent through CMCA, we have you covered with this piece of the regulation. We provide this template violation letter, which gives specific instructions to the employee or candidate. By providing this letter to the employee when there is a DOT drug or alcohol testing violation, you as the employer fills your 40.287 requirement through us as your SAP service agent. Instructions direct the employee to contact ASAP in order to meet the 40.287 requirement on your behalf. You provide this information to the candidate or to the employee, whether you plan to terminate or offer a second chance to meet your 40.287 responsibilities. In addition, this is a helpful graphic that guides the employee through the steps in the process to understand what they need to do. This can be provided with the violation letter when an employee or a candidate has a violation. As I mentioned, there is no cost to you all or to the employee to act as your service agent filling this requirement, since CMCA has you covered through the relationship with ASAP. If you do need copies of this, please feel free to reach out and we can provide you a copy of the violation letter as well as process card. We do also offer a credentialing letter for audit purposes. If you are being audited and you need a copy of that, just let us know and we're happy to provide you a copy. We are really proud of our 86% success rate year over year. That is a standard that we consistently do see year over year for SAP cases. So people successfully getting through the process and getting back to work safely. ASAP has assisted over 300,000 employees return to work safely and effectively. We do take on the toughest cases. ASAP has, as I mentioned, consistently achieved that 86% success rate. What we see a lot of it plays into effect is contingency management. So employees see the same SAP provider when going through the return to duty process. It gives an employee an opportunity to make life-changing decisions throughout the process. They understand that they have follow-up testing. So once they're back to work, they're continuously tracked. And it's an incentive for the employee to maintain clean drug and alcohol test. And oftentimes when employees are offered a second chance, they want to get back to work. It's their livelihood at stake. People are proud of what they do. They want to get back to work. They want to earn a paycheck to support their families and make money. So when they're offered a second chance, we see that they are typically very loyal to going back to work with their employer and grateful for that opportunity to get help. So again, I'd like to thank you all for joining today. Please feel free to reach out to our team if you do have any questions by phone or by email. We're happy to help. If you have any questions specific to your program with CMCA, please do reach out to the CMCA support team. They can help with assisting with any services or questions about assistance as their CTPA with reporting into the clearinghouse. And we thank you all for your partnership and have a great rest of your day.